Monahan, thank you again for your service here. I know I have used on occasion the office of attending physician, and which is something for me because there's three professions that I have never really cared to do business with. The first is a funeral director, the second is doctors, and the third are lawyers. However, the first one is inevitable, but I will only ever use it one time. The second will actually delay the time that I go to the funeral director, and the third usually drives you closer. So with that, I do have an appreciation for the work that you and others in the medical profession do for those of us. Now, Dr. Monahan, during the pandemic, the House Sergeant at Arms, in consultation with your office, issued health guidance and restrictions for the House office buildings and the House floor. Because, as you heard, there is appearance of political influence there. That's really what we're trying to get at, is to find out how things actually work. Can you explain to us how the guidance was determined and the approval process that the guidance went through prior to being pushed out to the House community? So you're working with the Sergeant at Arms. What was the process to come up with the guidance?
The initial episode going back to March of 2020, specifically between March 8th and March 11th, was a very harried time in the Congress of all the first responders and communities in the House and the Senate to rapidly position the organization to respond to a growing and frightening situation with hundreds or thousands of deaths in Europe coming, and with a fear that it would come toward us with the growing concerns. In the Congress, we have limited forums to have a campus-wide response to an event. One such forum is the Capitol Police Board. The other forum we have is the Joint Congressional Continuity Board. They often operate in a classified fashion. They came together with all the stakeholders on the campus community, and that involves the House Sergeant at Arms, Senate Sergeant at Arms, and about probably 30 people in a large room. And we began to look at the federal guidance for COVID-19, Department of Defense-related instructions with regard to concerns, and other national experiences for COVID-19 issues. From that, we created a posture as to how the organization would respond, that all the joint leadership then reviewed and embraced. And it created a circumstance of sentinel events that we were watching for. These were defined by key metrics that would occur. From that, we would derive one of three operating conditions for the Congress. Condition one was enhanced social distancing, simple things like no handshaking, 6-foot separations, limitation of gatherings, and that sort of thing at regular business. Number two, condition two would be reduced operating capacity, and number three would be the essential operating capacities for the legislative branch to perform their functions. So that was how we first started. That was the first guidance that started. As the pandemic arose, we participated in the executive branch-led initiatives to crush the curve, diminish physical activities, and shut down to a very low level of activities everywhere. Right around March 17th or so, the Congress had its last big sessions, a late night session, then the members returned to their home districts, and then we went into like a pause of like a legislative recess. During that time, each chamber wanted to come back into session as quickly as possible to address these needs, the House and the Senate. The Senate wanted to come back first. So the Senate leadership came to me to say, Dr. Monahan, we need to have operating practices that will allow us to come back into session and operate as safely as possible and do our work for the American people. The House echoed the same sentiment with the strong instructions that we're not going away, we're going to be here and get the work done. So from that, I began a process to create the first edition of the Pandemic Social Distance Guidelines. These guidelines are essentially the CDC guidelines. They have some operational elements that are unique to our organization and the work that the Congress does. So that's why they're shaped. They're essentially the same by way of what is isolation, what is quarantine, how many days if you're sick, et cetera, 6-foot separations, hand washing, maintenance of a daily health inventory before coming to work, sick people stay home, et cetera. From that, then, I went through a process back and forth with both the majority and minority on the Senate side, and immediately the majority and minority on the House side to come to a consensus. The first edition reflects broad consensus involving the U.S. Capitol Police, all the agencies within the Congress, such as the Architect of the Capitol, Office of the Clerk, and many, many talented people. So it took a long time for me and thousands of phone calls to come up with this, 10, 12-page, how we're going to operate. So that went out first, and the Senate came back into session, the House came back into session. My guidance to each body, both House and the Senate, was the same. However, as a student of the Congress for the past 15 years, just kind of watching them, there's a profound difference between the House and the Senate. It's not a simple matter of terms of election and terms of office service, but rather their policies, their chamber operations are very unique. And each leadership group would take my same advice and operationalize it. And that's how you'd see some variations from the House or the Senate. Things went along pretty well, and you saw the additions of my guidelines go on with further things. And one thing I would stress throughout this is the coronavirus was novel, meaning previously not seen, with unknown features. There were many judgments made at the start of coronavirus that turned out to be not fully accurate as to how it was spread, what the risks were, some of its response to various seasons, how much it would strike the American people. So it's constantly changing. So you'll notice in the guidelines as the CDC updates their response for new and emerging science, my guidelines would update also. I would say moving along, if I have a few more minutes, Mr. Chairman, I'd tell you, moving along to some critical events into 2020, when we get to the summer of 2020, there starts to be like more issues, more deaths, more sickness, more issues, prolonged shutdowns, suffering of the American people, deaths, hospitalizations, National Guard mobilized to keep our hospitals open, intensive care units built in parking garages, et cetera. And in the middle of that, each chamber was meeting in session, having their votes, et cetera, and trying to do the best they could to minimize the spread of disease. On the House side, there were significant differences also in the chambers. The House having 4 times more members, more travel, more reaches out to every corner of the United States to gather back again, and have this large gathering of people in inside spaces. The Centers for Disease Control would often characterize risk levels, and the House floor turned out to be the highest risk scenario. Members of varying stages of health, traveling throughout the United States from varying high-risk, low-risk areas, et cetera, coming together in an enclosed space. So they required quite a bit of suggestions with regard for best practices. And again, the leadership had their roles of enforcing those things. So there's a difference between guidelines I provide, the same to both chambers, operational aspects about how they function as unique bodies, and lastly, enforcement was different between the House and the Senate, how the members chose to enforce these practices.
So you provided the same guidance both to the House and the Senate. And was the leadership of the House and the Senate and the House Sergeant at Arms consulted by your office at the same time?
Yes, sequentially. So there were, with all the decisions were, I can't talk to the people on big conference calls all at once, but I would talk to them sequentially, go back and forth, share documents, ask for input, synthesize, go back another round, and it finally come to a thing we could all agree upon.
So if you sent guidance to the House, same guidance went to the Senate?
Yes.
At the same time, okay.
There's a slightly different form, Mr. Chairman. One last thing I would say, we don't have communication tools to the entire organization. The Senate doesn't have a Dear E-Colleague letter or any kind of broadcast tool to communicate instruction. So I use a joint Senate leader letter written to both leaders. The House has a tool called the Dear E-Colleague electronic distribution system for which we don't have access. So you'll notice my first remarks in this regard come through the Sergeant at Arms because we didn't have access to the system initially, but CHA subsequently changed that.
Okay.